before they come in for a massage. So these are the things we want to make sure of, just for the safety of the client.
Blood clots.
Okay, so you're going to take care of that. You want to be hydrated before you come in?
You could be. You definitely want to
Yeah.
hydrate after a massage.
Why?
Absolutely. To help flush the toxins out that are often stirred up from the fluid moving massage.
You know, there's some people who think that sounds like a lot of mumbo jumbo.
It's not mumbo jumbo.
Okay. You know that, though.
I know that.
Yeah. So you have gone through the conversation. Everything's A-okay. You've squared what you're going to use with Alicia. Now what? Now how does it start?
Now, I'm just going to start with some strokes. Typically, though, I will say, you know, I would start with some holds and some compression, just to kind of get used to each other's energy.
Okay.
Okay. So, but because we're going and we want to
Right.
see rather than see stillness. This is more.
I
of
feel
a
relaxed already.
It looks good.
This is considered Swedish massage. This particular stroke is called effleurage.
Effleurage. Okay.
Effleurage.
This is a stroke that not only lubricates the area to be worked on, it introduces the therapist touch to the client, gives the therapist an idea of what's going on under the skin, under the surface, and it feels really good. It's a nice way to just make initial contact.
I know that you wonder what can you feel. A number of years ago, when I trained for my first marathon, I clearly, your body gets a little beaten up, and there was a fabulous massage therapist in the Del Mar area who had been a dancer. And I'd lay down on the table, and she would do this, and in 15 seconds, it was like her fingers were a divining rod. She knew exactly the spot that was going, oh, please set me free.
Work on me, right?
Yeah, it was just amazing to me.
With Alicia, you can already see the blood flow. There's a pinkening of the tissue that's already increased blood flow to the tissue.
It's not because you're troubling the area.
Troubling the area? No.
The area likes the touch. It's called hyperemia when you see this kind of redness come up in the skin.
Okay.
Very healthy.
Now, what's an average length of time? Should a massage be 30 minutes, 60 minutes,
I think average, I would say 60 minutes is more often what people think of when they do a full body table massage. But there are many places that would offer half-hour massages or even 2-hour massages. So there's really anything. If you talk to the therapist, you probably can find something that meets your needs.
As you continue doing the massage, what kind of training? How many hours, what kind of training does somebody need in order to become a licensed massage therapist in New York State?
New York State requires 1,000 hours of education, and at CNW we offer the 1,000 hours in 3 different program configurations. So we have a 9-month, a 14-month, and a 21-month program. Each program has the same curriculum. Students are learning the same lesson plans, but they can just do it according to their learning style, the speed that they need, or there are some students who have to work while they're in school.
Right.
So we recommend the 21-month program for that, or even the morning program, which is 14 months. It allows for a little bit more work time.
How much anatomy does a massage therapist have to know as they go through their training?
They have approximately 495 hours of science classes. So it's 150 hours of anatomy and physiology, 150 hours of myology, kinesiology, there's pathology, and there's neurology. So there's a lot of ologies.
A lot of,
yeah.
Sometimes, people worry that, you're going to push me a little, a little too much, you're going to press a little too hard, you're going to hurt me. Whether it be painful or not. How much, I guess what we're talking about is the trust factor, that your therapist knows what they're doing.
Yes, you want that. And a lot of times it's repeated visits that really develops that trust. But it's really about the client. So we really train our students to really talk to their clients, to connect often during the massage, keep asking, how is the pressure? Do I need to adjust anything? How is the temperature? Are you comfortable? We want them to feel safe on the table. It's a vulnerable position, and so we really need to respect our clients.
Too, finding somebody that you feel comfortable with and vibe with, you develop that rapport and a trust, and they know you, you know them, so it kind of minimizes that injury factor.
Now, how often do you have to, say Alicia was here because she was having upper back issues, shoulder issues, which is so common for those of us who may work in an office. You carry your stress, everybody carries their stress in a spot. How many times might somebody like Alicia have to come to really get relief?
Well, for maintenance, I would say a good plan is usually once a month. If somebody's got something actively going on, You know, what I commonly tell people is maybe try coming once a week until we really clear whatever is actively going on, and then we work on moving it out, finding what their maintenance rhythm is.
Now, insurance doesn't cover this. You're on your own.
Not yet.
Not yet. It's part of preventive, you know.
No fault, though, for some accidents. There are some companies that do cover all or a portion of the cost of a massage.
Mm-hmm. I really think that, and this, I'm going to just say this is my opinion, I really think the massage that is going to happen for longevity of massage is therapists are going to have to get educated on the medical bent of it. As much as we do, like we started in thinking about massage as being a luxury, really there's so many health benefits, and as they get discovered, really, I think it will be another modality for wellness.
Well, you know, when we look at hypertension, you know, given the obesity epidemic and now more people have hypertension, maybe looking at diabetes, if you can find something that will help you reduce your blood pressure along with your meds so that perhaps you can even lower the medication, the amount of medication you take. Isn't that just wonderful?
It is, and there's a lot of research to support what you're saying. There's massage research out there that shows that lowering medications, cutting down dosages, and sometimes altogether cutting out medications is possible with regular massage.
So, I think we've lost her. I think Alicia,
I haven't
been
heard
purring
any
like
snoring
a kitten.
yet.
Yeah. And let me ask, is that okay if you fall asleep on the table?
Oh God, yeah.
Yeah, you think that that's like a good sign?
What better place is there? You still get the health benefits, and you get a little nap too.
You know, sometimes it's the only quiet place you're going to find. So perhaps once a month, have a conversation, share your concerns if you're a newbie at this.
Absolutely.
Tell your massage therapist what you hope to get, what your concerns are, and be honest. Be honest and upfront.
Absolutely. The more honest you are, the better your conversation is and your communication, the better the massage is going to be.
We'll link to the site, and you also provide, your students need people to learn on, right?
Yes, we have a student clinic on premises, open to the public. It's part of their education. They're required to do 50 massages in the clinic. So there we are.
So come on down. Linda Adario, licensed massage therapist, Laura Iacovone, the Dean of Students at CNW. Go to the website. We'll have a link if you want to go over, learn a little more, get yourself a massage, and on the way to wellness. Ladies, thanks so much. Alicia, it's almost time to get up. That's it for us. Hope you have a great week ahead, and we'll look again next Sunday. Take care.